Bela, and this is Workstream by Partners, a show where we talk with industry leaders and experts about pressing themes and topics in business and beyond. Today, we welcome our guest, Sara Howe, Executive VP of Illinois Primary Healthcare Association. Sara, thank you so much for meeting with me today.
Thanks for having me.
I wanted to begin by asking you if you could tell me a little bit about your current position, your background, and what led you to become so passionate about the work that you do.
Sure. Well, it's an interesting story. I've been in my current position 2 months. Actually, it'll be 2 months tomorrow, I believe, that I've been the Executive Vice President of the Illinois Primary Healthcare Association. I came to the association by way of the behavioral health world. For the past 20 years, I have been with the Illinois Association for Behavioral Health. The last 13 of those 20, I was their CEO, advocating on behalf of community-based mental health and substance use providers in the state of Illinois. In that process of working in the behavioral health space, it became very clear quite rapidly that the intersection of primary health care and behavioral health was really critical. For example, probably a good majority of the patients that we see in the behavioral health system typically do not have a primary care doctor. Oftentimes they have a chronic underlying healthcare condition that has gone untreated. And what we find because of that is individuals with mental health or substance use disorders die on average 25 years earlier than the general population. Wow. So that intersection of primary health and behavioral health care is really critical. And that's what led me here to the Primary Healthcare Association. We advocate on behalf of community health centers. You might also know them as federally qualified health centers. So they work in underserved areas where there typically isn't a lot of healthcare opportunities, where they take care of that population that is in need of critical primary health care. They offer primary care, behavioral health. Many of them also offer dental. So they are really meant to be a one-stop shop where someone can get the services they need. The other really important and exciting piece about our community health centers is they serve anybody regardless of the ability to pay. So if you have insurance, they can take care of you. If you don't have insurance, they're going to be able to take care of you as well. And that's really, really important, particularly right now as we're in times of a pandemic as well. The intersection of all these pieces overlay on one another. So it makes this opportunity for me really a perfect opportunity to dig into what is really important to me, which is healthcare for all individuals.
That's really cool. Thank you for sharing. I wanted to ask you, could you tell me a little bit about how the healthcare industry has changed due to coronavirus?
Oh, the industry has really been turned on its ear really quickly. I think the first and most important thing we've seen is a strong shift to telehealth. So before this, we certainly saw different providers dabbling in telehealth. We saw more apps that were available where you can get online and maybe you had strep throat and you can take a photo and send that off. We did see that. We were starting to move in that direction. But the minute all the stay-at-home orders came down, that all changed literally that day where suddenly healthcare had to shift to telehealth. So that means many of our providers weren't in a place yet where they had all the telehealth equipment. To their credit, many states and the federal government said, we can do what we're doing now. We can use Zoom. We can use Skype. We can use Facebook Messenger. Not Facebook Live, because that's definitely not private, but something like a Facebook Messenger. They really quickly shifted to how can we reach patients. So a majority of patients right now are being seen through telehealth. That's not to say that has not changed in terms of people getting health services. Not everybody's comfortable with telehealth. In our industry, in our community health centers during the pandemic, we saw a 70% reduction in our wellness visits. We just weren't able to bring people into the community health centers to do those critical wellness visits. We could do as much as we could over telehealth if someone was interested. But at the same time, when you're completely changing an industry literally overnight, that also changes with the consumer. So those changes are only as good as the consumer wants them to be. I do think going forward, we're going to see telehealth stay. Consumers are getting used to that. That's what they want. They want to be able to reach somebody quickly. maybe they don't have to leave their offices, they don't have to leave work, or in the case of behavioral health, where unfortunately mental health and substance use treatment is still stigmatizing, if you can do some of that work via telehealth, via, again, a private, secure way to reach your therapist, then we do believe we're going to actually be able to reach more people that have some of those behavioral health conditions we've talked about.
Right. It's really interesting. And how do you feel like, or could you tell me a little bit about how mental health has been affected by coronavirus in general?
There's been a lot of research that's come out, and I use the term research lightly because obviously it's been 2.5 months since we've really seen this pandemic. So these aren't longitudinal studies, but what we have started to see is looking at the data we have that the coronavirus really hit our mental health quite hard. The last I saw, I believe it was a federal government data that came out that said in April there was 1,000% increase in calls to one of the hotlines, the mental health hotlines. So it's just one data point, but it's an alarming data point. We've also seen quite a bit of short-term studies that say we are going to see a 3-fold increase in opioid overdoses as well as suicides. And that is a direct result of anxiety that we're seeing talking about living through a pandemic, being quarantined to your home. It really lays bare some of the concerns that we have regarding our own mental health. But also, we were already in an opioid epidemic when this started. That didn't stop. That kept going. We just didn't focus on it as much. So we've also seen that where a supply chain went away, where people weren't able to get the drugs they were addicted to, that, in the end, the body and the brain are really interesting. We don't want people to use illicit drugs, right? But when you do, your brain gets used to them, your body gets used to them. So when we bring somebody into treatment, there's a reason why there's something called detox. There's a reason why we have time so that their body can withdraw from those drugs. Where we're talking about a pandemic where you're not leaving the house, you might not necessarily have the access, that's a critical health risk, an immediate health risk. I have anecdotally talked to some of our providers that work in the substance use space that have seen an increase in heroin overdoses right now. There's the other critical reason why we see that is when somebody stops, when they reduce or stop using, particularly when you're talking about opioids, if they go back to it, oftentimes they will go back to the amount that they were using previously. But your body is no longer at that same tolerance level. That's oftentimes where you hear of overdoses from somebody who is in recovery, did relapse, and then it was a fatal overdose. Addiction is a chronic relapsing illness. So it's one thing that we have to remember, that the brain is the largest organ in the body, and we impact the brain anytime we alter it or change it. So when you go back to your question about coronavirus, all these different pieces connected to our mental health, to those with substance use disorders, and at the same time, our mental health and substance use providers were having the same challenges that our community health centers were. Being able to bring people in the door, getting to them through telehealth. Are we able to reach individuals? I do think long-term that telehealth piece will again be really critical, particularly in mental health, because we will be able to reach more people where they are. And that's going to be a really big tool that we have to add to all the work that we're doing.
Right. And I'm sure that becomes all the more crucial when people don't have the same opportunities to like go to the gym or to go take a walk or see their friends, or the additional things that would help contribute to like a good state of mind. I hope that it does continue to be, that mental health continues to become more of a topic of focus. So I wanted to ask you, how has the stigma surrounding mental health changed in the last decade, and more specifically in the last year?
So it has changed in the last decade. I will say it's slowly but surely steadily changing, where people recognize that mental health is part of physical health. Like I said before, the brain is the largest organ in the body, but sometimes we tend to separate it from the rest of our body and think that it's different. So I'm not going to say that stigma has completely gone away. It certainly has not. We've seen some unfortunate polls that say, people are not comfortable with somebody who might be in recovery from a substance use disorder being their bus driver or being their airline pilot. We've still seen some really high numbers. At the same time, we have started to see some great polling that says that what people want is to treat mental health and substance use disorders in an integrated fashion with healthcare. They're starting to recognize that when we separated that out and we said, go here for your mental health and then go here for everything else, what we're doing is really stigmatizing people in general, instead of saying, this is a holistic approach, this is a comprehensive approach. And so we have started to notice that in the polling that we've seen across the country and in this state, that people are recognizing that they want mental health services. I think the other important piece, and it does go back about 10 years, and then we'll fast forward to now, is the federal Mental Health Parity and Addiction Equity Act. It's actually 11 years old. It was signed into law by President George W. Bush, and it said that you have to treat mental health and substance use disorders on par with other primary care illnesses. So that means if you're talking about diabetes, if you're talking about asthma, if you're talking about heart disease, whatever the protocols are for taking care of a patient with those conditions, they have to be on par with the protocols for taking care of somebody with a mental health or substance use disorder. It took away stigma and discrimination, particularly in the insurance industry. I'm not going to claim that it's completely gone. We still have a lot of work to do. In Illinois, I'm particularly proud of the fact that we have the strongest parity law in the nation. It took the federal law as the floor, and then we added quite a few additional protections for consumers, which is great. Those protections are only as good as the enforcement. So we're still working through those pieces. Now, fast forward, we've got the parity law. Obamacare came into place, and that said that mental health and substance use disorders were essential health benefits. You had to treat them essentially at parity. So we overlaid that, and now here we are in the middle of a pandemic. What the pandemic has done in the last 3 months has helped people recognize that we cannot ignore our mental health. It used to be something that individuals would think it was somebody else. It happened to other people's families. And then what we started to see is whether they were average people that we know every day or whether they were celebrities, people started to come out and talk about their anxiety, their depression, their opioid use disorder. I mean, all these different pieces have really come together to, I believe it was President Obama's last State of the Union. He spoke openly about addressing substance use disorders. I think the last time we talked about substance use disorders was the Just Say No campaign from a president up until before President Obama's last year. We've still seen that continue. We hear about it quite a bit through the federal government. So we know that that stigma is shifting. It's still, what I would say is it's still not enough. And I would challenge any of your listeners who are watching this to turn on TV tonight and put on an average show and let me know if you hear the word junkie, if you hear addict used in a derogatory way, the word crazy. That person's nuts, that person's crazy. All of that is our language, and that is really stigmatizing. And we still see that in everyday language. I mean, frankly, probably don't even have to go on TV anymore. Just go on Twitter and see. I will say, finally, I think the other piece where we've seen an increase in anxiety is because of our use in social media. There's been quite a bit of research that has come out that our use of social media has increased our anxiety as a society. And there's a keeping up with each other that we have to have on social media. The coronavirus may have shifted that, though, because we weren't going on vacations. We weren't all showing our best, fabulous lives. People were talking about how it was impacting them, what was happening, what were some of the challenges. So I'm hopeful that in terms of the stigma that we see and the resulting discrimination, that we can ultimately recognize that this is something that we all have. Mental health is important to all of us. We cannot be physically healthy without our emotional and mental health being sound as well. So hopefully that continues as we go forward.
Absolutely. And, I myself struggled with anxiety, a few years back. And then I became a yoga teacher and I started meditating daily. And it was crazy to me having like this realization of just how learning to use my breath as a tool was able to really just shift my mental health, and then therefore my work ethic and everything in my life.
Right.
It's really cool to hear about how mental health is becoming more of a normalized topic of conversation.
Absolutely.
How do you think mental health in the workplace is being handled right now? And can you share a little bit about why that's so important?
Sure. What we know is if we have healthy employees, then we have productive employees. I mean, that's sort of the basic piece of this. We all know that. We know that as employers and managers. Sometimes it's hard, I think, for particularly the American public to shift from what is my, I have a 9 o'clock doctor's appointment. I have to go get my annual physical till I have a 9 o'clock therapy appointment. There's still stigma surrounding saying that to an employer. But what we've started to see is that employers are recognizing if they have employees that are healthy, that includes their mental health. So it's in their best interest. So we've seen a lot more programs that employers that have EAP programs, employee assistance programs, where they offer that to their employees, where if they need something, they can get to a counselor or a therapist quickly. We've also seen more leaders talk about their own challenges. Like you mentioned, their challenges with anxiety. They've been really open that we're human too. Bosses, CEOs, managers, they're all human at the same time. And there's been a little bit more openness to share that. As well as when we go back to some of those critical laws, many of our insurance plans, not all of them, but many of our insurance plans now cover mental health and substance use. So you can get that if you're employed and your employer provides that health insurance. Oftentimes you're going to be able to get mental health and substance use coverage. So that helped as well. I will say, having talked with other countries, that America still has a long way to go. There are other countries that are more open about mental health. They are more open about saying, get a therapist. It's a great idea. It's still a little taboo in this culture, in this country. I will tell you, back in, I believe it was 2005, I was going through a leadership institute with one of our speakers was at the time the deputy drug czar for the White House Office of National Drug Control Policy. Very high ranking official that came to speak to us. And this is in '05. She said, if you want to be a leader in any field, get a therapist. And we were talking about behavioral health professionals at the time, and we were a little surprised because there's the assumption that you're the one that's leading behavioral health. You're not necessarily the one that should be procuring the services. And she said, you can't possibly expect to lead anybody if you don't manage your own stuff. And we all have stuff. And the sooner we recognize we all have it, we all have to address it, the better leaders we will be, and the better we will be in helping our employees recognize when they need to address their stuff. And that's exactly what she called it. And I've never forgotten that. And it's one of the things that I recognize all the time, that we should be just as comfortable saying, I have a therapist, as we are now comfortable saying, I have to go to my oncologist. And for a long time, people weren't comfortable saying they had cancer. I'm a breast cancer survivor. 30 years ago, I probably wouldn't say that on camera. Mm-hmm. Today, it's not at all something to say I've had breast cancer. So we're moving in that direction where with the pink ribbons and everything we've seen in healthcare, now we're moving in that direction in mental health care as well. And I think that's a really good thing.
Well, it's always really empowering to hear leaders like just openly discussing these prevalent issues, especially mental health. So I know that due to coronavirus, there's been this rapid transition into the telehealth environment. What do you think the long-term effects of that movement towards telehealth are going to be?
Well, I think there's a couple of long-term effects. From an employer standpoint, I think it's here to stay. Regardless, I will say, of whether our federal or state governments want it to happen so rapidly, consumers are going to demand that. So telehealth is going to be here to stay. The challenge, I think, will be where is that line between something that can be a telehealth visit and then something that needs that further follow-up. So from an industry point of view, from a healthcare point of view, we're going to have to get really good, really fast at identifying what is it that needs that next follow-up to get that person in the door. The good side of that is if you've tried to go to a doctor in the last 3 months, you've had to jump through many, many hoops just to walk in the door because of coronavirus. So now if we're shifting to telehealth, then we're triaging those patients without having to walk into the door. And then the ones that are really sick or just really need some additional follow-up that you just can't do. You can't do an MRI right now over telehealth.
Right.
Maybe one day we will. I'm terribly claustrophobic, so I certainly hope so. But in general, I don't think we're going to get an MRI over Zoom anytime soon. So there are going to be things that we absolutely just have to do. When you look at some of our chronic disease care, when you talk about diabetes, heart disease, asthma, there are indicators that we can discuss over the phone, and then there are going to be things like blood draws where we just have to check what's going on. We have to do a chest X-ray. We still can't do chemo, over telehealth. So it's going to be a shift in balancing what can we do via telehealth, what does a consumer want, and getting them in the door when we need them. My hope is that because we're not seeing as many of those initial patients via telehealth, that you can get in quicker. I mean, we still know that in this country, it takes a long time to get into something like an emergency room, to get an appointment for an oncologist or a specialist. This might really help rapidly shift that. If you look at some of the data from just the COVID-19 situation, we've seen emergency room visits go way down. Obviously, because they were stopping you at the door and turning you around if it wasn't a true emergency. That peel back to what we talked about in the beginning with our community health centers. That's where our community health centers come in, because a lot of times people will use the emergency room as their primary care. Well, they don't have to do that if they've got that community health center. They can go to that community health center via telehealth or in person and get that critical primary care handled without having to clog up our emergency departments. So then that could help us get people in quicker when we do have a significant trauma, a significant emergency. So I think to answer your question, you're talking a radical, rapid shift in healthcare happening overnight, which means, there are going to be missteps. We're not going to have everything resolved. And consumers are trying to figure that out too at the same time. So that's going to be a really critical piece as well. So I think that's what we're going to see. We're going to have to keep an eye on it. And we as healthcare industry professionals are going to really have to listen to our patients, have to really determine what they want and how we deliver the best possible care to them in the way that they can get it as rapidly as possible.
Do you find that it's difficult to spread the word or awareness about these community healthcare centers? Or how do you go about doing that?
What I actually find is that people sometimes don't even realize they have a community health center in their community. I will pull up the list here in Illinois, or you can look all around the country and find them. And people will say, oh, I didn't know they were a community health center. So once you realize that the Center for Family Medicine down the street is a community health center, it sort of changes your view. I mean, these centers are at the forefront of healthcare in communities near and far, and they are giving some of the best care. I mean, when you think about the fact that they have primary, behavioral, and dental under one roof, dental is most of the time, not everybody has dental, but most of the time they do. Where else do you find that? Where we see that kind of wraparound service, in my own patient experience, was with a cancer institute, where we had a wraparound we had the oncologist, we had the radiation oncologist, we had chemo, and then we had the oncopsychologist that dealt with mental health. They called it those cancer institutes. We see those all around the country, and people really go to them because it is that one-stop shop. Our healthcare centers have been doing that for a long time. I mean, this has been since the 60s that we've had health centers. So I do find that sometimes it's hard to get the word out, but many times people just don't know that that's a community health center. They didn't realize they could go there. They didn't realize that they would take patients regardless of their ability to pay. So it's really eye-opening when you have these discussions with individuals that, hey, this is in your community. It's a service to you and it's available. people get a little bit more comfortable and familiar, because when they just hear a term like federally qualified health center, they don't know what that means. But really, this is somebody that's in the community, an organization that is invested in their community, doing critical work that at the end of the day, if we are going to achieve equality in our country, as we currently look at racism and social justice, one of the most important things we've been talking about is health equality. We've been talking about it since the 60s. Dr. Martin Luther King said it was absolutely critical. That's where these health centers came from. That's what they're born out of. So I'm really excited that I think we're going to see even a bigger shift to utilizing them as we need to, and more people rapidly recognizing that they're available.
Wow, it's really cool and really powerful. I didn't even really know that there was such a thing as a community health center. So thank you for sharing with me as
Absolutely.
well. Could you tell me a little bit about what the next major issues ahead in healthcare might be?
Well, I think we've talked about them a lot. I think telehealth is going to be the first one, and probably the highest priority one. Given that we are dealing in a pandemic as well, part of it is going to be the intersection of public health with healthcare. What is the role of our health professionals in managing these pandemics? I say that with an S, hoping that we don't have more. But really, if we look back, we've certainly seen quite a few in other countries where it's come up, where we've seen more epidemics, and now we're seeing it across the globe. We have a global society now. And that's where I think this is very different than where we've been. People travel, they go to different places. We're able to, flights typically aren't so terribly costly that you couldn't, before the pandemic, hop a flight to Paris and then over to Rome and then come back. So because of that, we're a global society. That's wonderful. We are much more connected to people in Australia than we ever were before. That also gives us the opportunity to look at our healthcare differently in terms of what we can bring back, what we might see. I mean, that's really at the end of the day, when we're talking about this pandemic, we are a much more global traveling society, and that's where this has occurred. So being on the forefront, being aware of these rapid changes, things like vaccines. I mean, what we typically see is vaccine trials are 5 years. And what we're hearing now is obviously 5 years is not going to cut it for a vaccine trial. That's going to change the pharmaceutical industry and not only how rapidly they scale up, but our Food and Drug Administration making sure that what we get is safe for us. So all these different pieces intersect. And then at the end of the day, it comes back to the patient that is walking in the door of that health center, walking in to see that doctor that is determining what is their best level of care. How can we manage that? What we saw in the recent past was that healthcare shifted to a much more quicker visit. We didn't have those hour-long visits with our doctors that we used to have. We've brought in managed care, which has changed things. Now I think we're going to have to take a step back and determine how we're going to listen to our patients, not just for that patient, but what are they saying that might tell us what is next on the horizon? What do we need to look at? How do we manage the global public health population? The final thing I will say about that goes back to our behavioral health. So right now, if any of you walk into a doctor's office, you'll hear somebody say, tell us, do you drink? How much do you drink each week? Are you having thoughts of suicide? Are you feeling anxious? Are you depressed? I've done my own little experiment, and when I go into these places, I ask them, what are you going to do with this information? What if I told you that I was drinking 2 bottles of wine a night? Oftentimes, I see this in the urgent care clinics. They'll say, well, we just mark it down. Mm-hmm. We're going to have to really shift from writing that on paper to intervening, looking for those clues and intervening and helping people. That's really going to be where we know our healthcare system has really started to work for us, is we're listening to our patients, we're providing those brief interventions, we're referring them to the right specialties, and then we're keeping them engaged so that they're getting their wellness visits. They're getting all of the things that we know keep people healthy, from a primary through a behavioral health and dental as well, which has been an area that we've sort of forgotten, but is really critical also.
Wow. Um, I wanted to take it back to talking about mental health in the workplace and ask you, what is one tip that you could offer employers in regards to how they can destigmatize mental health in the workplace?
I would say the first thing is, well, one tip is, first of all, make sure that your healthcare coverage covers mental health and substance use. I think that if there's nothing else you can do, go in, look at the benefits that you're providing your employees, and make sure that you have good mental health and substance use coverage. And then make sure your employees know that you have that. Being open about the fact that you are taking care of the employee population and recognizing and saying to them, we want you to have the best healthcare. That includes physical, mental, behavioral health, emotional health. We have that coverage. I think that's really important. An employer doesn't need to be, they don't have to share their own personal story. That's not something that I would say everybody has to do. What they can do, if they're comfortable saying, hey, I've got a therapist too. If you need one, you need to get one. This is a place where you are absolutely welcome to do that. And we have coverage. You will be able to get your sick time just the same for mental health coverage as you will physical health. That's something that's really good. I have seen, like I said, in other countries where employers have been very open about that and said, hey, I'm leaving. I've got my noon therapy appointment. See you later. I'll be back in an hour. That's up to everybody's comfort level.
Mhm.
Where you do see leaders doing that, then everybody else is comfortable with that. It definitely destigmatizes that. But that's obviously at a comfort level. At the very basic, make sure you have that coverage and make sure you tell your employees you have it, because it's important that they take care of their mental health. That's what I would say would be the most important thing right now.
That's great. My final question for you is about leadership. So, in your experience, what are the most important qualities for a leader to embody and why?
Wow, that is quite a loaded question. But I will give you what I think is mine. Having been through several leadership trainings and really tried to mentor other leaders as well as learn from some of my mentors, I think the first thing is knowing that you don't know it all. When you see a really strong leader, they are not necessarily that person that has all the answers. And matter of fact, they may have more questions than answers. And they recognize that they don't know it all. At the end of the day, we're all human. We all have a lot of questions. We probably have more questions than we do answers. Somebody who recognizes that they get power and strength from working with each other, listening to each other, and then they take all that information to make that best decision. Sometimes people have to make decisions. So you can't do everything by consensus. And a good leader knows what is consensus building and when it is time to make a decisive decision. The ones that are respected most are the ones that have the conversations. They might not, your employees might not like the answers that you get, but you're open and you're honest and you're direct about them. I actually just finished a webinar last week about conflict in the workplace. And what was interesting, that the data showed that employees would rather be direct about really uncomfortable information than ignoring it. Employees were happier when you came to them and said, look, you have been absent the last 3 weeks every Monday. Instead of saying, so where are you at? What are you doing? I mean, what's going on? You know, that kind of conversation. As a leader, those conversations can be really uncomfortable. And it's hitting conflict head on. However, what we find is individuals respond to that. There's accountability in that. So when you step back and you recognize you don't know everything, first of all, and you're open that you ask questions, when you do make a decision, you communicate that decision. You communicate why you made the decision. I think from a leadership point of view, those are really critical pieces. Also, just recognizing your own shortcomings and utilizing each other to help with that. We all have strengths and we all have weaknesses. So we really build some good synergy when we work together in that process.
Thank you for sharing. Thank you so much, Sarah. This was such a pleasure for me. Thank you for making the time to speak with me.
You're welcome. Absolutely. I'm happy to.
For those of you who are new to Workstream, we are the hiring platform of choice for non-desk employers, trusted by over 5,000 hiring managers to automate and streamline job postings, scheduling, and employee onboarding. To learn more about us, head over to workstream.us. Thank you for tuning in to this week's episode of Workstream by Partners.